Hi everybody, this is Dr. Nikitow. Welcome to the chiropractic approach to. Today what we want to talk about is the chiropractic approach to ankle and foot problems. Now behind me I have a high school lacrosse player. His name is Jordan. And Jordan has had some problems with his knees. He's probably had problems with his Achilles tendon, his heels, where the doctors told him that he had Sever's disease, which is an avascular necrosis or a problem with growth of the area around the heel. As we look at patients like this, we're going to point out some real specific things. So doctors, if you're watching, I want to point out some real specific adjustments that we do to help with these types of problems, and then some of the types of exercises that we give patients like this that we would find in our chiropractic approach to exercise series, which for the ankle and the foot. Okay. So the first thing I want to point out is, Jordan, why don't you stand up real quick? Just stand up right here and kind of face the camera. Okay, now the first thing we always want to do is we want to take a look at the posture, and the reason that we want to do that is because as we're looking at Jordan's posture, that could be thrown off as a result of the feet. When the feet start to cant one way or the other, it's going to toss the hips and twist the hip. So it's very important that we do that, okay? And a person like Jordan, where he's a lacrosse player, he plays the attack position. There's a lot of cutting and moving in lacrosse, like a lot of these athletes have. And high school athletes need to have a chiropractor and a healthcare team, just like everybody else, because especially for the trauma that they go through with lacrosse, which can affect their neck and other parts of their body. But we also have to make sure those extremities are in the proper position. So as I look at Jordan, one of the things we're going to see is that we'll check his feet, we'll check his knees. Now why don't you just pull up your pants there for a second. Okay, so one of the things I want to point out here is that when we look at Jordan's feet, they're pretty straight. In other words, he doesn't have a lot of pronation in his feet. He actually has pretty high arches, okay, which is something that we'll see a lot of times when we see the arches shifted like that. Now Jordan, why don't you turn around, okay, all the way around, so the back of, and doctors, what you want to be doing is you want to be looking at how that Achilles tendon is lining up here with the heel. Now his seems to be pretty good, so this oftentimes could be overlooked because when you're seeing that the Achilles tendon, like what I'd like you to do, Jordan, is just kind of roll your, stand towards the inside of, roll your feet in like that. Now if we were to see the Achilles tendon move like that, that would indicate a pronation. Okay, go ahead and stand regular, Jordan, like you normally do. So we can see that his Achilles tendons are pretty balanced. Now why don't you go ahead and turn around. Now what we want to do here also is take a look as to how those feet are affecting the knees and the hips, okay? Okay, so now one of the things we want to take a look at is when Jordan's laying down right here, I'm going to bend up his knees like this and then stretch them and then bring them back down. Now you can see what's happening here is he's laying down. Instead of his foot rolling, being nice and even, he's actually rolling his feet this way, which would indicate that he's got a knee problem, okay? So we're going to check here at the knee, and we can actually see that he's got a, what we call a posterior fibula. Although his heel here is pretty even, what's happening is he's rolling his whole leg. That's why his foot is moving in this direction versus being like this, okay? So ideally when a person lays down, their legs should be like this. Well, Jordan's are rolling quite a bit in. So what we have to do is check his knees here, and we also have to check his hip joints. So we know right here that his fibula, or the outside bone in the leg, is out of alignment. Now, this bone that runs here, which is called the lateral malleolus, or the ankle bone, is the same bone that's here. So now what would happen is if this bone was off, it would be like a pencil. If you're tilting one way or the other, this area here would affect the ankle. So we have to adjust this portion of it to actually affect this, because if this is going backward, this is going forward, similar to if we took, say, a pen, and all of a sudden if we move this area here at the top or twisted it, it would cause this to move. When this moves, it's the old ankle bones connected to the knee bone thing. This is going to affect how his heel is. So basically, doctors, when we take a look at these types of things, what we're going to do first of all is we're going to check the tension that's occurring in his heel, okay? Now we can see that he's got a lot of tension. Now basically this Achilles, if we were to bend here, should squish in more, okay? Now he's got a real tight Achilles area over here, okay? So basically when we see that that tendon's that tight, we'll notice, look at the lack of movement. Now I'm pulling pretty hard here and I can't move that heel hardly at all. This heel doesn't even move, okay? And this one here is worse than this one. Jordan, when you injured your Achilles tendon and typically have problems, is it worse on the right than on the left?
Yeah.
Okay, a lot worse on the right. Also, we see that his ankle bone and knee bone isn't quite as rotated on the left side as it is on the right side. So what we want to do is we want to talk a little bit about some of the adjustments we need to do in this area. So Jordan, why don't you scoot up on the table because I need your foot to be all the way up to the top here, okay? So as we are going to adjust this, the first thing we want to do is adjust his Achilles tendon. Now what we'll use is we'll use this little, what we call a Thule adjusting board, okay? This is a little drop section board that we use that you can increase or decrease the tension on. Now what I'm going to do is I'm going to place that underneath Jordan's ankle here, and all we're going to do, because we know if his Achilles is too tight, usually this heel has moved this way, okay? And so what we're going to do is we're going to open up the joint by on the whole heel and ankle joint by adjusting straight down. You'll feel that little point drop, okay? So we're going to lay it there, and we're going to just adjust it this way, okay? And we're going to take this one, do the same thing, okay? And I'm going to turn his ankle to the right position so we can get everything in the right position so the nervous system picks up the correct input. Okay, one more time on this one because that's pretty tight. Okay, now, if we look at that, now we're going to check the heel. The first thing I want to point out is look, just from adjusting the heel, how this has come a little bit more this way, but look at the movement we're getting on the heel. Okay, now, if this heel does not move, it will start to generate shock up into the knee. This is where a lot of athletes end up getting strains and sprains in their knee, and they go to physical therapists and they go to other people and they try to do rehab on muscles alone. They're always doing work on muscles. Okay, if those joints don't move, your shock is not being generated. You got all these little bones in the foot that you have to generate shock on. Okay, and especially if this heel's not moving, he's going to generate shock over here through this portion of the foot, and the next thing you know, he's going to end up having knee sprains, strains, and everybody's going to be playing around with the knee. It's not going to fix anything. You have to get this heel has to move like this, okay? So that's, I mean, look at the movement in this one. Okay, now we still got a little bit more to do because we have to adjust the knee, so let's go ahead and do that. Okay, so when I go ahead to adjust his knee, what we're going to do is we're going to adjust his fibula. Now I can also do that with the drop board, and I'll show you how to do that. But what I like to do is I like to take the knee this way, and then what we're going to do is he's going to put it over my shoulder, and I'm going to rotate the knee, and then we're going to give it a little thrust. So just relax it. Okay, and you could probably hear that pop that occurs. Go ahead and scoot up. Okay, good. And again, we want to make sure also that the hips are in alignment as well. Okay, so now when we take a look at the foot, you can see how they're starting to line up. I mean, just look at his heel. This heel, okay, as we did that with his leg, this is way, way back in alignment. Okay, so now we've got this fibula bone rotated back this way. Look at how he's laying with his legs now, how they're more even instead of before when it was turned way over in that position, okay? So now we bend up his knee and then lay it back down. You could see how basically, you know, he's got more evenness to this where it's not rotating inward. Now, if you want, you can also adjust this bone by placing the little drop board here, okay, and increasing the tension and then driving straight down on this area here. So that way, you know, the patient, and this works really good for little kids if you have to adjust their fibula, but you can go straight down like that, okay, and you do a few of those, and that also will help that area. So the next thing we want to do is that we're going to work our way upward. We're going to check the hips, okay, to make sure the alignment is occurring in the hips themselves. Okay, so basically we'll check a sacrum. Now we notice that a sacrum's off this way because when we look here and I press down in these two areas, I'm pressing the same amount of pressure. My hand sinks way over here and it's way up here. So we know that his sacrum is tipped upward and shifted over. So one of the things we're going to do here is adjust this, okay, over. Now, we can confirm that because if we look at his leg is shorter on this specific side. So when we go ahead and take this and we make this adjustment, okay, we're going to drop the sacrum there and drop it here. Okay, so So now what we've done, now if you look at my fingers, you'll notice that they sink in more evenly, okay? All right, and then now if we take a look at the leg length, okay, the leg length is also a lot more even, if you could look at it that way. You see that? Okay, go ahead and roll over on your back. Okay, so now what we want to do is I'm going to show you how to check his hips, okay, because once again, the ankle, the foot, the hips. Right now, as we look at his hips, okay, what we want to do is we want to check his motion. Now, to go on this particular side, he doesn't have any internal rotation. He hardly has any. Look at how that leg is moved this way. Now, if we take a look at his left side, which is the better side, look how much further this goes out. Okay, so his range of motion, his pelvis here is great, okay, rather than his hip joint. We're checking the hip joint. This one hardly moves at all, okay? So what that means is that this whole rotated leg, as this leg has been rotated, okay, it affected the knee, it affected the hip joint. And we can actually palpate here at the head of the femur and feel that this femur head is popped up, okay? One other thing you can do is check to see how they can turn in on their feet. Now we'll notice here that he can turn in a lot further on this side than on this side, which means he's got a tight psoas muscle which runs in through here. So the first thing we're going to do is we're going to adjust his hip joint. Okay, so I want you to bend your leg and let me do all the work. And I'm going to take his hip into the position here and then thrust it down. And we're going to set it closer to the socket, and as we do this, it's going to increase his motion on his leg. Now watch this. Look at the hip now. Look at the motion on it. Okay? Now patients, if you have problems with hip joints, you know, where doctors say, oh, you have to have hip replacements, or if you have pain in the groin this way or over here, or going upstairs or getting out of sitting positions, your hip joint is out of alignment. We have to address the pelvis, okay, as well as the hip joint, because a lot of times people end up with back pain that never goes away because nobody's ever checking their hip joints. Chiropractors, you need to check that hip joint as well as the knee, as well as the extremity here. Now the last portion of this is what we're going to look at here, is we're going to look at the top bones in his foot, okay, because as we feel these bones here, I can feel that Jordan has a problem with his talus bone, which is the ankle bone, where these two leg bones, the tibia and or the fibula, tibia here and fibula here, are articulating or joining with this talus. Okay. Also, then we have a problem with the navicular, which is this top bone over here. Okay, and what happens is when these kind of get jammed, the patient can have a lot of problems running. Okay, and they'll have a lot of pain in their arch here. So we have to get these adjusted. So with Jordan, what I'm going to do, especially on this right side, we're going to take and we're going to adjust his talus and his navicular, so that opens that up, and that way patients with high arches like that, see what's going to happen is it's going to free that whole area up. So I'm going to kind of give you a quick tug, so just kind of relax. Okay, good. And you probably heard a big pop there. Now scoot up, and then we're going to do this one as well. Okay, scoot up. And once again, we'll see that. Now the last thing we'll check is his toe, his big toe, because if that's not moving, then that is going to put a lot of stress in the joint too. Okay, so when we're looking here, we're going to be checking his first knuckle, okay, or first bone, and that doesn't move too great. And all these little metatarsals, I can feel that they're dropped. So what's happening is because he has such a high arch through here, okay, this portion of the metatarsal here is okay, but these distal metatarsals, there's supposed to be an arch here, and he's kind of dropping, so he's overloading. He's putting way too much pressure here. So what we're going to do is we're going to adjust this first bone here by doing this way. Okay, you can hear all that, and that's just a decompression of the joints. Now we're going to lift up his toes, and we're going to adjust straight through here on this metatarsal, distal metatarsal. Good. Okay. Now let's check this one. And once again, we'll do the top knuckle first. Okay, and you heard a lot of movement in there. Now this one will affect this outside metatarsal. It's attached to the little toe. So once again, when guys have problems with the heels moving, you got to check all these little bones in the feet. And now we're going to do this metatarsal arch. Good. Okay. So now what we've done is we've adjusted the foot. He's got great movement in his heels. Look at that movement compared to what we had before. Look at this. Okay. Now, the last portion of what I'm going to do here with Jordan is he's got a little bit of what's called supination in the heel. Now that we've taken out, the hip's been fixed, Okay, we've got the fibula fixed. As he's laying here, he's pretty straight, but now I can sense that the heel is actually rolling just a little bit this way. Okay, and what we're going to do is we're going to go ahead and adjust that. So Jordan, go ahead and lay on this side, please. Okay, so once again, what we're working on here is we're working on this heel. Now remember, this heel, when he was laying face down, was rolling up this way towards me. So what we're going to do is we're going to take our Thule board here, and what we're going to scoot up a little bit on the table so you're more comfortable. Okay, and what we're going to do is place his heel here. Okay, just like this, when he's on his side. Okay, and what I'm going to do is I'm going to leverage this so when I make this adjustment, this little table will drop, and all of a sudden that heel will shift. So watch. Okay, we're going to do another one. And this way the patient's protected from any pain. You can't do this adjustment on a hard surface. You have to have a drop section in order to do that. So another way of doing this is to take the heel, okay, on the lateral aspect of the heel, and you're going to contact here on the low end. And what you're going to do is bring the top of the foot towards you while you're driving the heel over in this direction. So it would be more like this. Okay, it would be a thrust like that. What that's going to do then, again, is it's going to bring the heel out of the supinated portion. Supination is where the heel then is rolling this way, okay? So we would take the bottom of the heel and thrust it to bring the top of the heel over in this direction. And you heard that. So a couple different ways to do that. I like to do, on some patients, now the supination is completely gone. Okay, so basically now we've completed our adjustments, and when you're looking at his legs now, these legs are now perfectly even. Look at the movement on this Achilles. Okay, before it was hard as a rock. Now it's soft and spongy. Okay, you can see the whiteness even in my thumb is hardly there for when I push on that. So we've got awesome movement in the heel. Okay, look at the movement in the heel. Okay, we've got alignment in the knee, and we've got alignment in the hip. Okay, so basically what you can see is we've done a lot of work in helping improve the mobility and the alignment of the foot, which is going to make a tremendous difference in how he stands, how he runs, how he cuts. Now, you have to do more than one adjustment. One adjustment doesn't set the bone. So you public that are watching, understand that these problems sometimes become chronic. So they have to be adjusted frequently in order to remove the memory the body has and allow more stability. You know, a lot of people go and use orthotics and supports and things like that. That's not going to work for you. That's not going to increase the function. The only thing that's going to increase the function of the body is the actual adjustment that you have to have to the joint, and only chiropractors do that. And you have to have a chiropractor that knows these dynamics, that understands how to adjust the extremities and all those relationships, because otherwise this can affect all the way into your lower back because you have a problem with your foot or your ankle. If those are never fixed, that's never going to help anything. Jordan, why don't you come on up, please? And just kind of take a walk over there and come on back. Okay, that's pretty good. How's that? How do your ankles and scoot over this way? How do your ankles and your feet feel now after we adjusted you compared to before?
They feel better.
How so?
They're
specifically, like when you walk and everything, what do you specifically feel different than say before you got the adjustment?
They're not as tight. I feel like they're more stable.
Okay.
And they just feel stronger.
Okay, okay. No pain in the arches or across the, because I know you were always getting pain that was going up the back of your calf, and sometimes this will also cause things like shin splints, which can go on the back of the calf or the front, because a shin splint is nothing more than those tissues being overloaded and they start to pull away from the bone. So does that feel pretty good along your shin, along your calf?
Yeah, I feel no pain.
Okay, and how about on the hip joint and stuff like that? Because that, when you're walking, you were telling me that a lot of times you would feel that pressure-y feeling in your hip. Does that feel a lot more loose?
Yeah.
So you ready to go out and nail it on the lacrosse field?
I am.
Okay, thanks. Okay, some of the exercise that we would give patients that have ankle and foot problems, Achilles tendonitis, shin splints, different things like that, pronations, high arches, flat arches, different things like that. We like to use the chiropractic approach to ankle and foot exercises, which are called chirosize. These work really, really well for, and they're very, very simple for those applications. First off, we would do some stretching. We would use the ankle and foot stretch where you turn the foot in out, up, down. You can use the floor to kind of stretch the front of your shin by placing your toes on the floor and just kind of leaning into it a little bit. You can move your ankle all around in different positions like alphabet, like spelling out alphabet words and things like that. The Achilles calf stretch, where you would stand next to the wall and position one leg behind the other and then keep the knee straight. Bend the front knee and then lean into the wall until you feel the back leg stretch and hold for about 10 seconds, and then switch legs and go back and forth on that. Then in terms of strengthening, you would use a resistance band and attach it to the foot or ankle, and then you could attach it in a doorway, something like that, and then just kind of move inward, outward, up and down, and hold for 3 to 5 seconds to give it a good isometric strengthening position, because isometrics work real well with strengthening the joint area around the ankle. Then we would do some calf strengthening, where you could stand with the balls of your feet on a step or on a platform of some sort, lower your heels until you feel a stretch up into the calves, and then push up and then hold for about 5 seconds. So you're basically just stepping up on your toes. You could also, if you're maybe an elderly person or you've just had surgery or your ankles and calves are really weak, you could take a laundry detergent bottle or any kind of large household bottle like that and fill it up with water to tolerance, and then place it on the top of your knee and just push up against that resistance and hold for, again, 3 to 5 seconds. And then a couple great exercises for arch strengthening that have been used with ballerinas and people who are dancers and things like this, is where you can throw just a household towel onto the floor while you're watching television and sit in a chair, and then just crunch the towel up by grabbing it with your toes. And as you do that, you'll feel the arches in your feet work, and it's a great exercise for strengthening the arches of your foot. Another great one is what's typically called the ballerina exercise, where you sit in a chair with both feet on the floor, and then you flex the toes of one foot forward, then run your big toe all the way up your leg to your knee, keeping your arch flexed, then hold for about 3 to 5 seconds, and then slowly go down to your ankle again, and you'll feel a lot of tightness and contraction. You'll feel a lot of contraction in the ankle and in the arches, and that's a great way of strengthening your arches. So these are some great exercises that we like to give for ankle and foot problems, and they have a great application for not only prevention but for rehabilitating ankle and foot problems. Thanks again for watching the Chiropractic Approach to, and on this series we were talking about ankle and foot problems. Please be sure to ask your chiropractor to check your ankles, your feet, your knees, your hip joints, because that's going to make a huge difference in how your back holds its positions and its alignment, and the ability that you'll be able to do when you're playing all types of sports, if you're playing a lot of sports, whether it's high school, college, or even the Pee Wee level.